Today, we're gathering around the campfire with Dr. Bryan, a QHS member whose life is as exciting and grounding as a hike through the mountains. But what trails did he tread to reach these heights? Let's trek into the wilderness and discover the adventures that led Dr. Bryan to where he is today.
Hi, QHS family. I am Dr. Bryan Frank, a medical missionary and also an integrative medical doctor specializing in anti-aging and regenerative medicine. And in spite of a long career in the integrative health and wellness field, in the last 3 years I've struggled with multiple health issues myself, including severe arthritis in my hip, more moderate arthritis in the knees, vertigo from an acute viral episode, and elevated cancer profile numbers. These health issues have led to a great deal of pain and have interfered with my medical missionary travel, and so I'm looking very forward to reporting numerous health victories from the products at Quantum Healing Systems, and excited to get well. Hi, I'm Dr. Bryan, and I'm going to do my prequel here. My family is from the Franco-German Celtic area of the world. Great-grandfather came to the U.S. through the Port of New Orleans. I was born and raised in Texas during the Beaver Cleaver era. I'm an identical twin. I have an older brother. And as we were growing up, we were very active in Boy Scouts, all of us attaining Eagle rank with God and Country Award as well. During early years of school, I was very average, except for advanced reading skills. A teacher in the 7th grade inspired me, and I went through grades 7 through 12 with the highest GPA in the school each year. And then I was honored to give the valedictory address with my Christian witness before about 10,000 people at graduation. We were also all very active in cross country and track, and I continued to run for exercise and pleasure into my 60s when injuries forced me to stop. I went through divorce after 27 years of marriage, but have been blessed beyond measure with my wife of 14 years now. And together we have 5 kids, 12 grandkids, and 6 great-grandkids. I became interested in medicine at an early age, but with conventional medicine failing to address some of my personal health issues, I was heavily involved in nutrition and acupuncture in high school. Felt motivated to pursue medical school so I would be well educated in conventional medicine and then be able to deliver an integrated health practice with the best of both worlds. I began serving in missions while in high school as well and had a strong calling to be a missionary. And I've served in countries all over the world, Nepal, Kenya, Mexico, Ecuador, Costa Rica, India, Russia, Haiti, Dominican Republic. And that's been a very busy part of my life until a few years ago with the international insanity of COVID and also the last couple of years due to personal health challenges. In addition to being a medical missionary, I'm also an ordained pastor, and I enjoy preaching and teaching both at home and abroad on missions. And I've been very active in leading and teaching in alternative medicine, primarily in medical acupuncture and integrative pain and sports medicine. I do have a long history of experience with various bioelectric therapy modalities, including Rife, Tesla, and others. I joined QHS the day I was told about the vision and the work of Dr. Alfredo, and I look forward to being a QHS leader, hopefully offering clinics, teaching, and expansion to other nations as that becomes available. In addition to my practice mentioned above, I'm also an anesthesiologist and an anesthesia pain specialist, and did a 4-year fellowship in anti-aging and regenerative medicine. I have an active part-time clinic treating patients in an integrative manner. My current needs for the V9 Plus would be to address vertigo from a viral illness I experienced 2 to 3 years ago, a history of atrial fibrillation and past congestive heart failure, as well as high blood pressure, severe left hip arthritis, and mild moderate knee pain. And then I have an elevated PSA and CA 19-9, both of which are potentially indicate cancer, but at this point I have declined to have any biopsy. So that is my backstory.
Join us on the Prequel, where every story matters and every voice is heard. Because here at QHS, we're all about healing, learning, and growing together.